a post-CAIRS patient, the marking is very important because you have to exactly measure the outer edge of the tunnel. The trephination is done along the outer edge. 300 micron guarded knife is used to dissect the trephined area 360 degree. Care is taken that the groove is done along the outer edge of the CAIRS tissue. Once the groove is made, a lamellar dissection is made along the pocket. You can see that I am using a side port to open up the area of the stroma which is not covered by the CAIRS tissue. This is very important because if you put a groove along the tissue, you will not get the exact depth to reach a good big bubble. Pointed dissector is used to create a pocket. A DALK needle with the opening below is inserted into the pocket and a big bubble is achieved. The anterior chamber is deflated and the air is injected into the anterior chamber. The lamellar dissection is done and it is carried out along the entire 360 degree. The lamellar tissue is removed and excised. This is the CAIRS tissue which is being removed carefully in toto. This is known as impulsive slash, where I am releasing the air. Once the air is released, the plane is very well seen and it is cleaved. The plane is opened with the blunt scissors. The entire stroma is completely removed, bearing the Decimet's membrane. You can see how the Decimet's membrane is very shiny. The Decimet's membrane from the donor tissue is removed. The donor tissue is punched. The donor tissue's peripheral rim is trimmed to match the recipient edge. Once this is done, the sutures are applied. While suturing, care has to be taken that the bites are lamellar and are not full thickness. 16 sutures are applied radially. Once the sutures are applied, the knots are buried onto the donor side. Once the sutures are done, the anterior chamber is filled with saline.